broadcast center in Los Angeles. This is KCAL9 News at 6 a.m.
Well, it's Prostate Cancer Awareness Month, and joining us now with some things we all should know is Dr. Robert Princenthal. He's a radiologist at RadNet, and it's nice to have you here bright and early this morning. Thank you so much. So why do you think it's so important to bring awareness to Prostate Cancer Awareness Month?
Well, it's important because men and women have the exact same incidence of their diseases. 180,000 men and women are diagnosed each year, and roughly 30,000 men and women succumb of that disease. But October, everybody knows, is Breast Cancer Month, and men need to take a page from women and learn to get checked and make sure that they're screened for prostate cancer.
Okay, so let's talk a little bit about symptoms. Are there symptoms that men should pay attention to?
Usually not. Men get confused between BPH, which is simply a big prostate, which happens as men get older. They have to get up and go to the bathroom more at night. But the symptoms of prostate cancer early on are very minimal. I mean, sometimes you can have some bleeding, but most of the time it's a silent disease.
Oh, okay. So what are some of the hurdles then for men who are interested in getting screened for prostate cancer?
Well, there are controversies with PSA screening because in the past, if a patient had an elevated PSA, the next step would be to see a urologist and get 12 needles put in the gland without guidance.
Wow.
That hurt, and they didn't find a lot of cancer. So men were reluctant to get screened, but now we have some new ideas to help with that.
And what are now the new
Prostate MR has really been proven to be a game changer. I think we're at an inflection point, and just the way women get imaged with mammography, men now prior to a biopsy should ask for a prostate MRI, and we're calling it a manogram.
A manogram, I like that. And this now, in comparison to all those needles, this is a pain-free
It's a
test?
simple imaging study because before the prostate was the only gland that would get biopsied without imaging, and now we've made tremendous improvements with detection with prostate MR, so we can triage men who would benefit from a biopsy versus men who we think don't have cancer and can avoid the dreaded biopsy.
And so now this screening, is it giving you better looks earlier? Are you seeing stuff that you didn't see before?
We're much more accurate at finding prostate cancer with MR than we actually are with breast cancer with mammography.
Really?
So it's really a great triage tool. So we recommend a PSA blood test, not to forget the physical exam, the digital rectal, and then the prostate MR. And with that data, we can triage men to who would qualify for a prostate biopsy.
Okay, and when do you suggest that men start doing all of this?
We recommend, of course, screening at 50 and to continue on until at least 75.
Okay, and that's an annual checkup.
Yes,
Okay.
exactly.
Real quick before we let you go, are there some special resources that are available to men who are interested
Sure.
in this?
We have a great resource on our webpage at radnet.com. There's some great support groups in town, Prostate Cancer Research Institute, PCRI.org, and of course, Men to Men and Us Too.
Okay, and great survival rates when you get this caught early, just like breast
Yes,
cancer, right?
so more men live with their prostate cancer than die of it, but you have to get tested, you have to get screened, and don't be afraid.
All right, doctor, thank you so much for waking up early and sharing this important information because, again, September Prostate Cancer Awareness Month. And if you want more information, all you need to do is go to our website, kcal9.com. You can see this segment again or just get more information.